Oh, great. We've got lots of folks already joining. Hi, everyone. Welcome to our August Coalition for Health Improvement meeting. Oops, I'm moving already. You'll see please introduce yourself in the chat box. So put your name and your organization. Yeah, hopefully some of you have come prepared with questions. We'll wait for a couple more minutes and then I'll do a little roll call of who is on the line. Welcome, Betsy. Hi, Sahara.
Welcome, everybody.
For those of you who are just joining, please put your name, organization, or just what brings you to this meeting into the chat box. And then we'll start with a roll call in just a few minutes. Next time, Michelle, we should have a little lounge music while people come.
We should.
Yeah, yeah.
And you know, we have call-in listeners, Alana, and I think there is an option when you call in to type your name into the chat. It is a little bit trickier, so I hope our call-in users can do that.
Great, that's a great.
Welcome, everybody.
Let's see, make sure.
I did see our panelists come in
Mm-hmm.
through the main. Aha, here's one.
Great. For those of you who are just joining, please put your name and organization in the chat box. We will get started in 1 minute. Literally 1 minute. Okay. Well, I'll get started with a roll call, Michelle, and then I'll pass it over to you. I'll do a little overview of the meeting guidelines, and I'll pass it over to you.
Thank you.
That's great. Welcome, everyone. My name is Alana Maynor, and I am one of the co-leads of the Okanogan Coalition for Health Improvement. The other co-lead is Michelle Sandoval, and Michelle will be your facilitator today. So my very easy job is just to go through the roll call, just so you all know who is on this particular call with us. So welcome Betsy Weiss, contact tracer for Okanogan Department of Health and MedTel at Home. Welcome Sahara Saval, NCACH, Shannon Mendoza, Bright Start Services, the B3 program, Melody White, the Family Health Centers, Lisa Apple, Okanogan Behavioral Health Care, Dawn Anderson, Coordinated Care, Brooke Luckensmeyer, Room 1, Sarah Fox, Pascal Sherman Indian School, Laura Brumfield, retired, Doug Brandt, Okanogan Behavioral Health Care, Kelsey Gust of Action Health Partners and the Chelan Douglas Chai, John McReynolds, North Valley Hospital, Cindy Button, Aero Metal Rescue Services, Alan Fisher, CEO Mid Valley Hospital, Nicole Roach, Okanogan County Community Coalition, Donnie Guerrero, Community Engagement with Molina Healthcare, Megan Barton from MVH&C, Kathy Olson, Okanogan Behavioral Healthcare, Megan Barton to all panelists. Alan Fisher is also on the line. Stacy Auckland, Okanogan Community Coalition. Cindy Button, we've got Cindy. Terry Mail with the Colville Tribes Native Connections Program. John Chapman, NCACH. Katie Haven, candidate for Okanogan County Commissioner District 2. And Jessica Kuzma, independent community member. Nancy Spurgeon, Coalition for Children and Families in North Central Washington. Peter Morgan, FHC Board and Okanogan Chai Leadership Team. Crystal Escherman, Public Health. Andrea Carper, Upstream. Nicole Smith, school nurse, Brewster School District. Karen Schimpf, Chai Leadership Council, community member, North Valley Hospital. Nicole Smith, school nurse, Brewster School District. Oh, I've already said Nicole. Going to be announced twice, Nicole. Lori Jones, Public Health. Bill Snyder, OBHC. Anyone else who has just joined us, we encourage you, please put your name into the chat box so we know who you are and that you're here. We are excited to have you here. General meeting guidelines for us. Again, chat your name in. Questions are welcome during the presentation. You'll see on your screen a Q&A feature. So please use that Q&A to ask questions. All of you can add your own comments to the questions that come up. We have a tremendous amount of knowledge and expertise just among the members who are on this webinar. So really, we encourage you to share your knowledge and wisdom in that Q&A or in the chat box as you see fit. Let's see. If you do ask a question, Michelle will be our facilitator and she will make sure the panelists get a chance to answer those today. Speakers, please do pause occasionally and ask if anyone has questions in the audience. And with that, I will pass it over to Michelle Sandoval and add a quick reminder that the webinar today is recorded. A few folks who joined us: Grace Larson, PBCRC, Stacy Coronado, Pascal Sherman Indian School, and Sue St. Clair of Family Health Centers. This is a tremendous group of people, and Rachel Levy. Welcome, everyone. Michelle, I'll pass it over to you.
Okay, thank you, Alana. Would you be able to move to the next slide? Thank you. So welcome, everybody. Thank you so much for joining us today. Today's topic, our main topic, is the impact of school on schools' COVID plans on public health. And we have a great set of speakers today. We also want to use today to provide a census update, provide COVID-19 communications update, and also to do an announcement for a new youth organization and a call for reviewers for our 2020 CHI funding from the NCACH. So to get started, I did want to introduce you all to the central topic of today's meeting, which is school COVID plans on public health and why that is important. And so we have invited representatives from the Brewster School District. Elvia Martinez is with us today. Stacy Coronado and Sarah Fox from Pascal Sherman Indian School. Stacy is the school counselor. Sarah is a language immersion director. Steve McCullough from the Tonasket School District, he's the superintendent there. And then we also have, for our second half of this topic, we have Bill Snyder and Jackie Wyman from Okanogan Behavioral Healthcare and Melody White from Family Health Centers. So before we get started, I do want to just kind of put the reason behind this being that schools are really struggling. We know to try to find an appropriate way to open safely and appropriately during COVID, and many of the schools have decided to begin school sessions online because of the numbers that we have here in Okanogan County. And what is concerning to many public health providers at this time is that we have several groups of young people and children who we would consider at risk. And when these school systems are failing, and what I mean failing, it meaning that the safety nets that are typically in place when we provide in-person instruction, and we have meetings in person, medical appointments in person, and we have counselors and everybody checking in on kids. When those things can't happen, we really have to be creative. And so we wanted to do this meeting to really support schools in figuring out what do they need to support youth and children, and to figure out what providers, our local providers, need as well. So with that, I would like to welcome our part one presenters, and I believe that we have everybody, our panelists on. Elvia, there we go. This is Elvia Martinez. She's the Brewster School District nurse. Sarah Fox, who is the language immersion land instructor for Pascal Sherman Indian School. We also have Stacy Coronado joining us from Pascal Sherman Indian School. She's the school counselor. Let me make sure we can get your video going, Stacy. Thank you. And Stephen, I don't believe we can see Stephen yet. And I'm hoping perhaps Steve is a call-in user. Steve, if you are a call-in user, if there's a way that you can let us know, perhaps send me an email and I will try to get you on with the rest of the panel. Okay, so thank you. So we'll just go right ahead and get started, and we will take a round robin approach where we'll ask the first question to our panel, and you each will kind of take an opportunity to answer that first question. So the questions that we sent to our panel of presenters today, the first question was in regards to the anticipated effect of school closures on mental health and at-risk young people. In particular, those facing existing social and economic barriers, and also those children who may be special education, have IEP plans, and so forth. And we wanted to hear from the schools on what is currently, what do they anticipate the effect of these school online plans being on these groups of young people. So Elvia, I will start with you.
Okay, so my name is Elvia Martinez. I've been the Brewster School nurse for 15 years. And last year, I started the migrant health program. And I think that the impact will be disconnection from the school support services, such as the school nursing and the food and counseling services. And so that will definitely impact the students. Like, for instance, the food services are currently run by the Boys and Girls Club, and they do like 285 to 400 meals a day. And we do have like a 900 plus students, so that is like less than a half they have been served. And for school nursing, we have been available the whole entire summer, but we can only connect with a small number of students. So that disconnection is really going to impact our school. The counseling services, I'm assuming that is going to be, or that it's been similar. So it's definitely impacting. And the decrease of services, definitely it's something that we have to think about, because, for instance, our clinics, and I think the Family Health Centers is on the line, they did close one and did telehealth only, and the one that is open was closed because of the COVID for a few days. So I don't know how long, because we don't really get that information. Today I called the optometrist, and they only seen a patient every other week and limited number. So we're definitely going to have a problem with the glasses, probably. And yeah, the internet services obviously is a biggie. For instance, mine is really slow. So if I Zoom for my meetings at home, I lose a lot of information. So I don't know how the students are going to feel about it. And the cost is really a problem too. one of the, yeah, so the internet. And then the superintendent actually have all the secretaries called every family to ask them if they had needed internet services or if they had needed a device. And he said that about 400 families will need support for either internet or computer. So that is a big number from our 900 plus students. So that's what I have.
Thank you so much, Elvia. Thank you. And just kind of a short follow-up question to that. Do you feel like the Brewster School District, there's a particular uniqueness? I think there's a uniqueness about Brewster School District, but do you feel like there are any unique needs for or a particular subset of at-risk kiddos in the Brewster area?
Yes, definitely. I think that our community is really like we don't really trust the telehealth as much, and I would really wanted to know if the number of patients being seen by telehealth, how is that impacting the clinic? Because I don't think that, or I have been calling families to remind them that they will need a well child check, and they are just saying, no, I don't think I'm going to do that because I'm afraid that if I go there, I'm going to get the virus, or I don't really want it to do it online, like on the screen. So there are several barriers for that. Does that answer your?
Yes, thank you.
That's so unique for our Hispanic community.
Yes, and I think that's a good question for part two for our providers. So
yes.
We'll hold on to that question.
Okay.
Thank you, Elvia. So I'll allow Pascal Sherman and Stacy and Sarah to answer this question. Let me know if you want me to repeat the question.
Good afternoon. My name is Stacy Coronado, and I have, Sarah and I have a little slide presentation to share with you all that will kind of give you a little bit of idea of what Pascal Sherman Indian School is about and what we're doing, and some of our needs that we're really looking at. So if I could get permission to do screen share, that would be great. And I'm hoping that this technology is very new to me, that this will work. So
let me try to do that real quick, Stacy.
Can you see my screen?
Yes, we can.
Yeah. So this is the first slide, and it's just my name and my information. And these are a little bit out of order. I was having technical difficulties, that's why I was a little bit late, and I'm sorry for that. And my hair's a mess, and yeah, it's not a good day. But so Pascal Sherman Indian School is located on the Colville Indian Reservation. It's about, I would say, maybe three miles out of Omak. It was originally founded by Father de Roger, and it was started as an Indian boarding school through the Catholic Church. About 1978, it was taken back by the Colville Confederated Tribes. It is now run and operated by the Colville Confederated Tribes, but it is funded through state and federal monies. We've been doing a lot of work. We have a grant through the National Native Children's Trauma Center. We're one of 10 schools, Indian residential schools in the state that has been selected, not in our state, but United States. It's been selected for this grant. So we've been doing a lot of work in the last year and a half on trauma-informed work. So we, in the process of that, we rewrote our vision, our mission, and included our values. Our focus is going to be on our language. We have 3 different dialects that are spoken by the 12 bands of the Cabo Confederated Tribes, all of which are severely endangered. So part of that trauma work is to revitalize our languages and to look at some of our traditional values that we hold as a people through the 12 bands of tribes that we have, which, you know, are our land and our environment, and really looking at putting our children first as a first priority in increasing the health of our nation. We have a high percentage rate, one of the highest in this county and probably certainly in the state of Washington, for minorities, for our youth suicide, more likely to be incarcerated in juvenile detention centers, more likely to be placed in foster care and not be returned home, more likely to become addicted to substances, child abuse and neglect histories. You know, we have very high percentage of academic achievement gap, huge lack of graduation rates, on to college rates. So we have a lot of catching up to do and a lot of work to do. But I think Pascal Sherman now is in a position, or we were before COVID hit, where we're really starting to pull in those services. We're starting to put in that social emotional learning in school and meet a lot of these gaps that we see in our student population. Our student population comes from all over the United States. We have children from the west side of the mountains. We have children from Idaho, children from Canada, Oregon, Montana, and then of course our local children in our large county here. So we have many different Native American students in our school from all over the United States. Some are residential and some attend day school. We also have other minority children and non-minority children that attend Pascal Sherman too. So I wanted to show and share with you a slide that came from an MTS conference that we just attended. And it's an initial forecast of the analysis of behavioral health impacts from COVID-19. And we are looking at this and looking at your question, which is what we are experiencing as a result of COVID. Some of the things that come to mind are, like I said, the furthering of the increasing of the achievement gap that we were already facing. Because
Stacy?
Yes.
I'm sorry to interrupt you, but if you could push present, that way people could see that graphic a little bit bigger, that would be great.
Oh yes, I sure can. Thank you. How's that? Is that any better?
Yes, thank you.
Okay. I'm very new to this, so any help I can get is very much appreciated. Like I said, the further increasing of the achievement gap is a huge concern for us because we've lost classroom time, we've lost instructional time with our students. We're also concerned about new trauma experiences as a result of parents' loss of employment. Our tribe has furloughed or laid off or cut programs. So a lot of our families work for the Colville Confederated Tribes and are out of work now. They're unemployed, which results in loss of housing. Witnessing of domestic violence. Our domestic violence rates have gone up. We have a lot of domestic violence anyway, but with COVID, it's spiked quite a bit. Witnessing of homicide, suicide, loss of family members, new grief issues as a result. And another concern that we really have is the unreported child abuse and neglect situations. We're concerned about the disconnection from the school-based services like Elva mentioned. The social emotional learning, we've put a lot of time into our programs, and Sarah will talk more about one of our programs that we have that's extremely crucial to what we're doing. Our interruption of the mental health counseling services that are provided to the students at the school. We have two mental health professionals. The one that's sent through the tribal behavioral health, which that position was cut. So we do not have a tribal behavioral health. We only have one MHP that's going to serve all students. Our substance abuse intervention and prevention programs, we had students that were receiving those services and counseling services and interventions while at school. That's a real concern. We have already had and seen overdose from drugs and alcohol with some of our students, as well as our students having witnessed drug and alcohol overdoses of caretakers. Big portion is the food service. A lot of our students were dependent upon our breakfast, lunch, and dinner that we serve at the school. A lot of times our kitchen, if we knew students were struggling with food at home, we would send care packages home with them on Fridays to make sure they would have enough food. A lot of our families have always struggled with food, but with COVID and the increased food prices and some of them, the lack of ability to get to the food is a big concern. The medical, dental, and like Elva, I'm going to repeat what Elva said, the optometry services that were provided by the school. For most of our students, they come in with big gaps in their medical, dental, and optometry needs. A lot of them had not been seen by a doctor, and we had one student that was undiagnosed for the curvature of the spine that we were working with. That was interrupted. So, I mean, there's going to be a lot of lag in getting these children their dental needs and their medical needs and their, optometry needs. We find a lot of students who are failing in school because they simply cannot see. They need glasses. So those are, some of the needs that we have, and some of our concerns. Homelessness, we had a lot of students. I think at one point I counted probably at least 25% of our student population were living with relatives in motels, in campers, or were not really at that moment in time sure where they were going to live other than, you know, foster care or some other temporary situation. So we have a lot of homeless students, a lot of them unidentified. One concern with our population is, like Elva said, is the trust issue. Very hard to get to trust enough to access some of the services. There needs to be more work with this population. Colville Confederated Tribes is one of the largest land-based and population-based tribes. We have 10,000 members and several million acres of reservation land here in Washington. So yet we are still facing a lot of disparity in all social issues within the state of Washington and in this county. So I will let Sarah go ahead and take over and see if I can get Sarah's slides up.
Before you go, Sarah, because I think Sarah's going to address the second half of the questions, and we do have, we're going to split the time between Elvia and Pascal Sherman, and I want to make sure you guys have some time, 5 minutes for Elvia and 5 minutes for Pascal Sherman, to address the second half of these questions, which are basically how have you modified things to try to fill in these gaps. So how have you modified your plans to try to fill in these gaps, but also what is left? And so I see some providers coming in and some tribe members coming in to ask, how can we support you? How can this public health community support the schools? How can the clinics help the schools in making sure that we fill these gaps for children and youth in Okanogan County? So I'm going to turn to Elvia, and then I'll return back to Sarah so she can address that question as well. Thank you.
Okay, so how can they help us? Well, I think that communication from the clinics and with the schools is really imperative. We didn't really find out that it was closed until we actually have to access it. So I don't know how they communicate to the community when they closed or how they changed their services. So I think that communication to the community is really something that it needs to be better. And the will child checks, I don't know how they working that out either. So we just need to address that and get more communication with the providers, with the clinics. And for sure, whenever or whomever can help us, the school will need, or all the schools in general will need the nursing services support. So if the public or whomever support the funding for the school nurses, it will be, you know, making a big impact so we can open our schools with safely. So, yeah.
Thank you, Elvia. I think that feedback is excellent, and certainly here, this is the start of that conversation, right? If we have some gaps, we really want to fill them here today. So thank you so much. I know that you were actually one of the individuals who emailed us and asked us about reaching out to our contacts to see about internet. And that is a huge concern, I think, for all of our at-risk youth and children, and for many of our families here in Okanogan County. I think I heard something like 40% of our young people don't have access to high-speed internet, and so that is a big number. So I just want to see if you kind of have an idea of how many of the families in Brewster School District might be struggling with that demand, that need for internet?
With the survey that the superintendent did, he said about 400 families or 400 students may need a device or internet service. So that is a big number from our 900 plus students. Yeah.
Yeah, excellent. So that number 40% is about right. 40 to
Yes,
50%. That's huge.
Mm-hmm.
Okay. All right. I will turn to Stacy and Sarah to let me know if you want me to repeat the question, and I'll let you guys go right ahead.
Sure. Stacy, it might be easier because my eyes can't see the presentation so well. If I'm able to share my screen, that might be the easiest way.
Okay, do you want me to go ahead and do stop share?
Yeah, that'd be great.
Ben.
All right. Thank you, Stacy. All right. So first off, I want to say how honored I am to get to be a part of this panel. Thank you, Stacy, for extending the invitation to be part of this, and Ms. Sandoval for being open to allow me to be here today to speak about something that I'm very passionate about. So I am the intervention specialist at Pascal Sherman Indian School. I'm going into, last year was my first year, and I'm going into my second year here. I have been running and operating a program called Nature Immersion, which is going into its 6th year this coming year. It's going to its 6th year of implementation. This program it originally started at, in El Sal Middle School in Salinas, Central California, which is primarily a migrant farming community. And it arose out of the really explicit, very similar questions of how are we going to focus, how are we providing resources for social emotional growth, for mental health, for our most vulnerable student population. So the students that I really specialize working with were our quote unquote highly at risk students, where these kids were being kicked out of their classes majority of the time. There was a very powerful and strong gang association, and a lot of the families were very much entrenched in that within East Salinas where I was working. So the program really arose out of the deep belief that I have, but many other people, and there's been a lot of cultural congruence here at Pascal Sherman specifically, of the ability to build neuroplasticity, so our brain's ability to reorganize itself and reform our neural connections through a mechanism of resilience, which I see as land-based immersion, so nature immersion. So to address the panel question more specifically, the impacts of COVID in our community and how we've really modified to fill these gaps. So in March, for everyone, it was really a mad dash to just put as much in place as we possibly could. For our school site in particular, it's vast inequity in terms of accessibility to technology, to internet access, and not necessarily having families who are working, not having individuals at home who were able to stay and support the kids to do their online schooling. There's also a vast degree of training that is really needed to take place, and our teachers and staff have been working heroically throughout the summer to really catch themselves up and prepare for our start date on September 16th. So since that March time of COVID hitting and having a little more wiggle room to explore what it means to be learning in a remote platform, how to encourage the same degree of engagement, how to create an environment where our school is predictable and safe and encouraging, which is really what all schools are endowed with that ability to do. So we're really exploring a lot of different platforms. We're going to be implementing a lot of new tech that it's going out and working its way to the students' homes, from Google Chromebooks to boosting internet connections, running a lot of parent and staff trainings to really try and get everybody up to speed. For my particular content area of nature immersion, I've really been struggling with some deep pedagogical practices, which the reason I became an educator for experiential place-based learning has really been challenged through kind of this remote learning platform. So I wanted to talk to you a little bit about this program. I'll make it very condensed. show you some of the data that we've been working with and how I'm having to modify this program specifically so we can still maintain the progress that we've been having. Okay, so basically what is nature connection or nature immersion? So this program, as I said, we're going into our 6th year we started in September at Pascal Sherman. So the program is really based on kind of this triad of 3 components of earth-based arts and technologies, sometimes coined as ancestral skills or wilderness survival skills, equine assisted learning, equine therapy, if we get to work with certified psychologists, and mindfulness and awareness-based exercises. So through this kind of triad, I am really building a lot of content. My curriculum is ultimately founded in experiential hands-on learning, which is all rooted to the land, which is all rooted to place. So I be following the seasonal calendar, and a lot of my content is really going to be dictated by what is happening on the landscape, in terms of restoration work that we can be doing with the animals, what the plants are doing in that particular season. So a lot of it, there's always the necessity, specifically now in a vast period of climate change, we have to be really flexible. And COVID is really flexing that, arguably. So that's really kind of what nature immersion is. So primarily I'm meeting with the students once per week, anywhere between 90 minutes to 2 hours. We started with an 8th grade class the first semester and expanded to 6th, 7th, and 8th grade, which is what we're going to be moving into this coming year. So the program, we're going out to Omak Creek and we're using what the land has to offer and engaging students through inquiry, through observation, and really getting them to take part in a lot of the land-based caretaking practices and a lot of the deep resilience that that connection with land is building. So as I talked a little bit about, that's something I've really been struggling with. How do I take content of like nature connection, nature immersion, and take it into an online platform? That's been really challenging for me in a lot of ways. So what I'm currently toiling with is how to translate this methodology of experiential education, which is following this really cyclical process of observation, hands-on reflection, and then getting the kids to conceptualize, think, and then apply this learning to whatever problem we might be trying to solve, any group-based. All of it is based on place. We follow this reciprocal teaching and learning model where I very much believe that we all have things to teach each other, and the students have as much voice and more so than myself or anyone else there. So we really take this peer mentorship model. Everything is very learner-centered, and it's all coming from a more of a soft skills approach. We're really promoting, encouraging, and explicitly modeling social emotional skill sets necessary to thrive. So one of the methods that we use to do that is when we do study of animals such as holistic tracking, bird language, but I really seen a lot of results from that specifically with a lot of our equine therapy. So the students, we do volunteer work.
Sarah,
yeah.
Sorry to cut you off, just because we have a bit of a time constraint, but I would love it if you could, in the chat, if there are particular gaps that that still need to be met by providers, if you could put those in the chat. And I think Stacy is connecting in the chat with OBHC right now. I see her connecting there, but just for the purposes of time, we could even follow up via email.
Okay.
And I thank you. This sounds amazing, like an amazing program. And I hope there is a way for you to be doing this with the COVID restrictions in place, either via home visits or some kind of once a week type of visiting program. And I apologize. I am going to move on to Steve from Tonasket School District, the superintendent. If we could get Steve by video, I just am gonna make sure that we touch on Tonasket School District and if they have any needs at this time.
There we go.
Excellent.
Now I can see everybody. Oh,
welcome. So Steve,
go ahead.
Because of time, if you could, in real quick, just a couple, 2 to 3 minutes, just try to try to state very generally the barriers that your specific students are facing, and also how you're trying to, how the school is trying to modify things, but also what are the gaps? Where do we need to fill those gaps?
My pleasure. And first of all, I'm so sorry for being late. I got caught up in a crisis at work, and we were trying to get school started next week, and you know how those things go. So I really wanted to be part of the entire meeting to learn from you and see what was going on in other organizations. But you know, with school starting, we're starting full remote. We have we have many barriers. We have a great plan going forward. We have great staff willing to reach out and meet the needs of people. We have identified and contacted a majority of our families, but this lack of ability to be, this is a social aspect of being a human, is such a problem that we have, not just with staff, but with our kids as well, and those families. We're still, while we have an educational model, I think will work well for us, it's the social aspects that we're the most worried about. And so we're using a lot of our staff to try to make individual contacts with people. We are like starting the school year with 2 to 3 days of conferences to meet individually with parents and families to learn what their needs are. But our biggest roadblocks right now, number one, it's the ability to contact people via internet, you know, and have that connectivity. And even those with connectivity, it's not sufficient to do things like this and have a meaningful conversation via Zoom or some other system. We have great support from OBHC. We have a full-time mental health counselor here on campus. We have 3 counselors, school counselors. That's still not enough. We need social workers or other people that are going out into and visiting homes during this time. Our special ed program, really worried about that community, but we're actually going to start going out and visiting them in their homes to try to help with those individuals. And as a school, we just put in for our variances to try to bring some of our students into school soon. Just the mental health aspect of it, if those of you that haven't heard of a program called JED, J-E-D, it's something that the Tonasset School District will be working with in the spring, most likely. And what they do is they come in and help you build a community-wide strategic plan around mental health. And those in our community that would like to be part of that, you know, like OBHC and other organizations, we would love to partner with you. And it's really around mental health and suicide prevention, which I'd love to do it now, but we can't get that going until the spring. So those are some things that are happening, and some of the things that are really concerning. Food distribution, we are doing that, so that's less of a concern than it was even 2 or 3 days ago, because we just received word from the state that we can use our transportation funding to support food distribution. So we're doing that 3 days a week, starting next Wednesday. Next Wednesday. So that's my down and dirty, quick response to you.
Thank you so much, Steve. That was excellent. So panelists, I would encourage you to, in the chat, we have a couple of questions regarding how schools are addressing the internet need. A lot of the schools are requesting that students sign in online and participate online. But as we addressed earlier, many of the most at-risk students do not have access to internet. And so what is being done to fill that gap? If you could just chat that into the chat box. I want to thank you all. Please stay, I hope you can stay on the call so that you can hear from the providers and from the rest of the CHI in the chat box on how they can partner with you all. Thank you. So I'm going to move to our second set of presenters, and we will just be doing a little switch up here. Excellent. Okay, I think we have everybody. So I have OBHC here, Okanogan Behavioral Health Care. We have Jacqueline Wyman and Bill Snyder joining us from OBHC. And we also have Melody White, the COO of Family Health Center. So welcome, welcome to our meeting. I do want to, we had to shift a little bit things in terms of time. So I just kind of want to orient you a little bit to the time situation that we do have here. So if OBHC could go first and address the question of what the organization is doing right now in anticipation of the needs that we saw and that we knew of from the spring. How do we expect those needs to continue, and what did OBHC do in anticipation of those needs? What are they doing now? And then also, are you seeing some current gaps? Are there other providers that could come in and help fill those gaps? And if so, to make that ask. And then Melody, we would have the same question for you all from Family Health Centers. So I will open it up to Bill and Jackie from OBHC.
Okay, I think I'll start. Well, we've been working all summer for one thing. We have school-based providers in many of the schools here in this county, and when COVID hit and school got out, we made our best efforts to stay connected to those kids. We transitioned almost entirely to telehealth. We've been seeing kids throughout the summer. There has been a dip in engagement for sure for those kids that have a difficult time with the internet, or kids that don't wish to have their parents a part of their services. Our providers have been doing phone sessions, Zoom sessions, FaceTime sessions, Skype sessions. They've been going out into the community, meeting kids at the park, at the schools. Some of the schools are allowing us to continue to be a presence and doing kind of a hybrid model. And that's been really, really helpful, because there are, a vast number of kids that just don't benefit as much from telehealth services. So allowing us to be in the schools and to see those kids that really need that face-to-face contact has been incredibly helpful. Over the last couple of weeks, I've been out and meeting with all of the schools, all the school counselors, talking about what their anticipated needs are going to be. We are gearing up for, I anticipate a large number of referrals when school starts, and school counselors and principals and teachers start connecting with kids again.
Thank you, Jackie. So I'm going to turn to Family Health Centers, and then I also, when I come back, I do want to pull up kind of a summary of what we heard from the schools, and provide you with an opportunity to kind of address those specific needs that the schools brought up. I think that would be great. So Melody, I will turn to you first, and
all right, that sounds great. Thank you so much. We are in a bit of a double jeopardy with the COVID situation, because we're not only dealing with how is the school closures affecting our patients, but we're also dealing with how the school closures are affecting our staff. We did a survey on our employees, and out of the staff that were surveyed, almost 25% of those staff are going to have to either take a furlough or work part-time because of the fact that they don't have either supervision for their younger children, or they don't have tutoring to help their older children do well in a virtual environment for school. So we're getting hit pretty hard with some of the ripple effects of the school closures. From the clinical standpoint, to Elvia's point, we definitely do have an issue with communication, because I'm not quite sure where it came from that we had ever closed our J Avenue clinic, but that has never been closed. So it may be that the access to some of those providers was limited. We have continued to have Indian Avenue as our virtual visit location, and they're actually opening up now to be able to see some in-office visits as well. We've definitely been trying to prioritize doing virtual visits, not only from a standpoint of decreasing infection risks, but also to be able to have the volume of patients inside of our clinics to be at a safe level in order to remain sustainable with what we're doing and to be able to limit the amount of bodies that we have in a safe way in our in-office clinics. We need to have about 50% of our patient visits be virtual. That's just the grim reality of the only way that we can make it work. So there are certain populations, Brewster is certainly one of them, that are not eager to embrace virtual visits. We are attempting to approach that from the standpoint of a more of a side-by-side mentoring situation. If a patient is showing a resistance to do a virtual visit, what we're trying to do is allocate some time with one of our staff so that when they do come in for an in-office visit, they can sit down with them side by side and show them how to use the app, walk through how it works, encourage them to be comfortable with that modality, and with the goal of having a secondary follow-up appointment via virtual visit. The other thing that we're trying to do when it comes to those well exams, originally when we thought that this was going to be a short-term problem, the approach was to go ahead and try and defer any of the well exams up to 3 months, with the understanding that within 3 months we would be able to have those visits in office. That's obviously not going to be the case. So we are doing a hybrid of a well exam that includes the majority, anything that could be more of a conversational or an assessment verbal type of a part of the visit, we would do that virtually and schedule a shorter nurse type visit where the nurse would be able to come in, do the vitals, do the hands-on exam, give immunizations, but rather than being in the office for a 45-minute spot, they would do, say, 30 minutes with a virtual visit and then a short hands-on in a controlled environment with a limited number of people of exposure. That's been working quite well so far. The other thing that we're doing in September is we're going to be doing a teen well exam clinic where we close the clinic. This will happen at each of our locations for half a day. And then we'll do additional sessions if needed, where we will close it to everyone but our teens, school-age kids that need a well exam. Then we're going to include our dental program. We're going to include warm handoff behavioral health providers to be available during that time and have that specific to just one patient demographic. This actually started from the concern about what's going to happen when we need sports physical exams. And obviously not much need to have free sports physical programs if we don't have school sports, but we're going to go ahead, do the sports physical form at the time when we're doing their well exam. That way it's ready when they're needed. We can quickly provide those to the schools. When it comes to what are our gaps, we do still have a lot of gaps. I think the child care for our healthcare professionals is a huge issue, not just for our staff, but our providers as well. We have several of our providers who are married to other providers. And so it ends up being a real problem when they have no health care. And unfortunately, even for the child care providers who are still doing some child care, there's a resistance to have healthcare professional children in their homes for fear that they have been exposed to COVID and they don't want to take that risk. So we have some real issues there on how do we not only provide for our patients during this time, but how do we provide for our staff providers to make sure that they're still accessible. So that's just a little bit from family.
Thank you, Melody. So I think I want to take this opportunity to talk about those gaps that the schools raised. And I saw some other gaps that came up in the chat from our panelists, including a concern regarding referrals to the Department of Children, Youth, and Families regarding child abuse and neglect. And I will say, as somebody who works for the department, our referrals are down. The main source of our referrals are from teachers, from school counselors, from doctors. And when those visits aren't happening and when people aren't seeing kids, we don't get referrals. And so I also heard some things from you all as provider agencies that there's some difficulty with telehealth, and because there is an issue of protecting staff. And so there's a trade-off that you have to make between staff and between the clients and safety and well-being for everybody. And so my question, I think I got a sense from the schools that the schools are aware kind of who their at-risk kids are, and will be trying to do what they can to reach out to them. And so my question to you all is, do you all have a sense of who your at-risk clients are, or are they all, or a majority of them, especially for OBHC, right? We have a lot of at-risk youth. So is it even possible to prioritize those in-person or those more hybrid type of visits? Is that even possible with staffing and those pieces? Is it possible to do hybrid or in-person modifications for our most at-risk populations?
It is possible to prioritize at risk, and it's something we do at OBHC. We talk about how to prioritize that, whether it's kiddos or adults, and are there individuals that we want to come into the, our lobby is open. Do we encourage certain types of patients or clients with symptoms to come into the building so that we are able to have a different kind of intervention with them? So, in listening since the beginning of the meeting today to the deep issues that we're facing through this experience, Melody said it was a double jeopardy. I mean, this is profound what we're experiencing, and Elvia and Sarah spoke about issues that they were trying to address before the pandemic even began, in that population and how underserved they are. So, I mean, this is tremendous what we're addressing. So, the school counselors with OBHC are definitely going to prioritize what they see as risk if they can identify that. The challenge that everyone else identified already is, if we can't identify things because of contact and the disparity between individuals that don't have internet or can't communicate with caregivers or teachers, absolutely is, in my opinion, one of the biggest focuses of our attention. And in reading the questions about today's panel, and who do we need to bring in? I mean, this goes up into the conversations with payers, with MCOs, with legislation around how are we ensuring that dollars are flowing where they need to, and considering technology now as part of healthcare. And that's a conversation that just began. So the importance of all of us collaborating and to the best of our ability being able to fill the gaps, whether it's informal or formal through treatment, informal through driving somewhere and dropping off meals, to formal being therapist, evidence-based practice intervention. But that was the long answer. The short answer is we can prioritize if we know. We are able to do that if we have information and the ability to communicate.
Thank you, Bill. And I'll turn to Melody to see if that's something that is feasible within family health centers, especially what we heard from Stacy and Elvia regarding populations being really hesitant about not only hesitant or distrustful about visits, but also technologically unable to do telehealth. So
one of the things too that we're trying out in Bridgeport and in Methow is setting up a telehealth station there at the schools, so that in conjunction with a school nurse to be able to have that hands-on nurse facilitation on the school side, setting that up so that it's in a location that does have Wi-Fi. There's someone that can help with the IT side of things. There's the hands-on special, making it a little bit more valuable than just a virtual visit without any hands-on at all. And this was something that we had been talking about doing when school opened. Obviously, it's going to be a little bit more challenging because the kids aren't going to be right there to just walk in and do it. We would have to schedule that to make sure that the room is available or however that is set up. But I do think that's going to open up some things if we can do that as a collaborative effort with the schools, not only for our primary care needs and things like that. That would allow us to be able to do some immunizations at the schools as well, but also to facilitate behavioral health visits and be able to do kind of both sides of that there. So I think we do have some ways that we can make it less onerous, and that we can have some in joint locations where we have access to be able to do some of those services. It's just going to be a matter of how do we make that work and not have it be really cumbersome to schedule and make sure that there's all of our ducks are in a row to make that go smoothly.
thank you. So I'm just going to share my screen momentarily and show you all the summary of what we heard from the schools regarding the gaps. And I think I'm just going to make it a just provide you all with an opportunity to just kind of free answer if you have any ideas, or if you know of a current solution that's being in place. So Brewster shared their needs for access to food, with half the students needing food support throughout the year. There was concern regarding access to counseling and nursing services that are normally just provided by the school when it is in person. There's access to healthcare. I think we've discussed this through this portion of the panel. Limited trust in telehealth, fear of contracting COVID if they go to an in-person visit. There also seems to be a particular, specialist appointment. So optometrists or specialty services are being highly restricted in terms of their availability. There's also poor access to internet for Brewster specifically. We're looking at 400 families who either don't have internet or don't have a computer, don't have the capability to not only not do school, but also not be able to engage in telehealth services. Pascal Sherman also shared similarly that there is a loss in food access, gaps in optometry care and specialist appointments, loss of access to the school-based healthcare. Again, for many of these schools and students, the health services are typically embedded in that school system, that in-person school system. Homelessness is something that Pascal Sherman students face regularly, but now with all of the downturn in the economy, that has increased, and we suspect that many of those families are unidentified homeless families. And then also there's the added difficulty of being geographically remote. So in general, they have limited access to resources. There's quite a distance between homes and stores and other services. So we're talking about, for some of these families, a 40-minute drive, an hour drive if we are requiring families to use a hotspot service throughout the county, like those provided by PUD. It's going to be quite a barrier. We also have, we know, transportation barriers for many of these families. And so this is all of that condensed unreported child abuse and neglect. I think I saw that from Tenasket School District Superintendent Steve put that in the chat. We also have, you know, a lot of these components of social emotional protective factors that were in place in the school are now removed because there's no in-school. These trauma experiences, domestic violence, the increase that we know happens when the economy goes south and when children are not seen by providers. We know there is an increase in child abuse and neglect, or even just adverse childhood experiences, not necessarily rising to that level, but that are negative and impactful to youth. The loss of housing, the interruption of services. So with systems being overburdened, maybe those appointments aren't as regular or consistent, or maybe there are technological boundaries that are interfering with that regular schedule. And then overdoses. So we are seeing the side impacts of parents and parents experiencing their own issues during COVID, and in turn, those impacting children and youth. So Tenasket summary, a call for social workers and home visits, and a concern about students and students with disabilities. So I'm gonna stop my screen share, and if anybody has any ideas from the broader CHI and you want to speak, please just chat us and let us know, and we can allow you an opportunity to speak. Otherwise, you know, if any of our invited speakers want to, I know a lot of you addressed some of these, especially the things that you are thinking about that you already address. But if you have any ideas regarding partnerships or anything like that, we'd like to allow an opportunity for you all to speak at this time.
This is Melody from Family Health Centers. One of the things that I wanted to throw out there is, in the past, before we had some of the waivers that are involved with what we can do during a COVID environment, Family Health Centers has been limited in how much community outreach could do based on the way that our FTCA insurance was limited. Up to March, we were actually not able to do off-site services. It had to be on one of our sites that had the certification as a federally qualified health center. Now that we have that waiver, it really does open us up to be able to provide services where they're needed in the community, as opposed to having the community come to us. So in the past, when we have wanted to do some things like physicals at the school or immunization clinics at the school, all of those had to be done on a voluntary off-the-clock basis, which really wasn't fair to our providers and things like that to expect them to do that work for free. Now that we do have that waiver, if there are ways that Family Health Centers can come to the community in order to do some of these services, and if we've recognized that there's a reluctance and a limitation to what we can do with virtual visits. And there is a fear in some locations, if they have a high COVID rate, they don't want to come to a location that has had a hotspot. So as the community is working through some of these things, if you've heard in the past that Family Health Center has not been able to go out into the community as much as you would like, a lot of those restrictions have now been lifted. So, you know, everything's kind of back on the table on community outreach. So please don't hesitate to give us a call if there's an idea of how we can actually embed ourselves more into the community, as opposed to having just in-office or virtual visits. Please let us know, because we'd love to be able to keep those other options.
I just want to kind of reiterate that, you know, I know one of the needs on that list was counseling and having access to counseling. in the schools especially, and just reiterating that we have a counselor right now in almost every school. They're connected with the school counselors. We get our referrals from the school counselors, and they are seeing people in person whenever possible. So that is happening. We also have the WISE program, which is intensive wraparound services for youth. That tends to be kind of the most at-risk youth that we have. And again, those providers are going to the home, seeing families in their home, seeing kids in the community and in their home.
Thank you, Jackie. I'm seeing in the comments that there are certain programs going on right now. So Jackie brings up a good point, right? There is already a system that can be used for counseling services. You need the referrals. And once you guys have the referrals, you guys can meet that need. And so I think certainly communication, and I have a hand raised from Kathy Olson. So I will let Kathy speak here.
Hi, I just wanted to reach out and say, I want to hold up the fact that Bill had said that OBHC's doors are open, and they are. And along with that comes the opportunity for folks that cannot access internet. We are offering to room them here and offering teleservices from our building. And so I want to be sure that the community is aware of that. If you have folks that are in need and they don't have access to Wi-Fi, they are welcome to come to OBHC and we will provide that for them.
Excellent. Thank you, Kathy.
You're most welcome.
So I think kind of, so what I'm hearing is probably that avenue to get those clients to you all just needs to be strengthened, I think. And so for the at-risk kids, and I think part of the problem isn't necessarily that pathway isn't there, but that it's difficult to know the need when the counselors and the providers aren't seeing the kids. So it's hard to make that initial referral because we know the problem exists, but we don't know because we don't see them. I think is part of the issue. Mm-hmm. So I did hear from in the chat. I did see that Jennifer Short also wanted to offer and provide and share the community action supports that are available for homeless youth, and also their food pantry services. We know we have food banks across the county as well. And again, I think the issue is there are services. It's how do we get those services in the hands of the families and the youth who need them most. And so certainly if anybody has any ideas of how we can strengthen that, I think we potentially have an idea to share at the end of this meeting. But I think that is part of the problem, right? Making sure that we know and connect everybody to the right resources. All right. Well, I'm sorry for you all who have asked questions and I missed them. Several questions were coming up in the chat, so I might not have been able to follow them all. Please repeat your question if I haven't addressed it. I also want to share that several people were reporting that school districts are providing Wi-Fi jetpacks, for example, to families who are most in need, and that there are also funding opportunities so that there can be more support for example, childcare providers in certain areas of the county. So those opportunities are all available in the chat. So thank you all so much, panel, for joining us. I do want to encourage you as well to stay for the rest of the meeting. And thank you so much.
Thank you, Michelle.
So I think we are going to do some quick updates on a few things. I believe I did skip over our census update, so I'll be providing that here. Just skipping backwards. Okay. So in a nutshell, where are we at with our census numbers? We did meet about this, had this a part of our CHIME meeting a couple months ago regarding our census numbers. We have increased slightly. We have a current response rate of 41.7% for Okanogan County. Right now, we have, I think we're still under the number of the 2010 response rate. There is still some time. We are still some time to complete the census. So we do want to encourage everybody to encourage your clients, encourage anybody you have contact with to complete the census if you have not, if they have not already. Again, connecting this to the dollars and the support that our county needs in order to get federal funding and many other avenues for funding, as well as an accurate representation of the needs of our county. If anybody has anything that they know about the census, I think Alana and I discussed this. Certainly, we are not the census experts, so if there's any efforts currently going on that need assistance, please put that into the chat. If anybody wants to speak about the census, please raise your hand and we'll allow you a couple of minutes to do a share. Any census updates from community members? Okay, thank you. So I'm going to go through and I think introduce our communications team. Alana is going to give a quick update about communications from public health. There you are. And I will hand over the mic to Alana.
There we go. Listening to what our school districts are struggling with right now, I don't know about you all, but that is harrowing to hear. And one of the reasons we brought them to this CHI meeting is that we know that our best strategy is going to be the one that involves the assets we have to work with here in Okanogan County. Our state's certainly facing a tremendous budget shortfall in the coming year, so a blend of both the funding that we actually have access to, advocating for the funding we need, and some of these really informal creative strategies that involve many of you who are great thinkers and have tremendous resources to bring, be it personally or within the organizations you work with, to help respond to some of these issues, I think is so important. At the end of the day, we have some great programs and strategies that are already working here in Okanogan County, and clearly we are going to have to pivot and grow because the need is changing, our community is changing. So what I think Michelle and I would love to just continue to hear from you all as CHI members are the ways in which we are pivoting and changing and evolving our strategies to respond to this. Honestly, I don't know how to say it. I feel like sort of harrowing overview of how our communities are struggling. Let's see. So I am just filling in for Okanogan Public Health communication teams with a specific question for you all, or specific request for you all as Okanogan CHI members. The public health communications team has been doing a lot of work to try to increase access to information about COVID-19 and try to improve and strengthen messaging and really try to influence behaviors and outcomes with COVID-19. And of course, we're talking about school reopening, but until we address the pandemic, our schools are all in a difficult position. So I think it's a very natural segue to be talking about communications with COVID-19 right now. One of the questions from public health that I'm hoping you all are willing to actively pop into the chat box and help us answer are the names of a few community leaders who would be willing to submit videos or do radio PSAs, reaching out to some of public health's focus populations. So a radio PSA may be something that encourages people to use masks. A radio PSA may be something that encourages us to care for each other and look at public health's website. We know from the CHI meeting here a couple months ago and lots of other community feedback that that strategy is going to be so important. So I am going to ask you all to put in the chat box the names of folks you know who are community leaders that you think you could help us get to say yes to putting a video together or recording a radio ad. Public health has a little bit of funding, and we know it is a key strategy. For example, let's see, we reached out to Megan Barton, speak up, so Lori Jones said, nice. For example, we reached out to police chiefs, fire department folks. Public health has been really clear that some of their priority populations are sort of 20 to 40-year-olds. Latino Spanish speaking folks, farm workers. Please let us know if you have ideas of who you know that we could reach out to invite to be a trusted community member to share that message. Megan, let's see if we can't get you to join us here. So Megan is, there you go, Megan. Can you are muted. But otherwise, you should be able to speak. Megan, as Barton, as some of you know, made a great video that she shared. It got filmed and shared on North Central Washington Life, and she also made a long post about her experience with COVID-19. Megan, can you hear us?
Hear me?
Yes, you're in.
All right, I'm sorry, I missed the very first question, but I'm happy to answer anything.
Actually, the question was, of the CHI, among the CHI members, who are some community leaders that you know who either you could reach out to or you'd like public health to reach out to record a PSA or a video? Maybe, Megan, you just want to talk real briefly about your sense of the impact of the video that you recorded and the story, why you decided to share it.
Oh, absolutely. So Lori, seeing how she's on the line, Lori had a great time harassing me while I was home with COVID. And I just have to say that with jest, of course. She was fantastic to work with, but there's so many people, there's such a strange, I want to say, misconception of COVID and of course of the masking procedures, the social distancing, hand hygiene and so forth. There's a misconception that masking will stop the virus versus it can't save you, when of course that's not necessarily it at all. It's actually about reducing risk. And that's essentially what we're all trying to do, right? We're trying to reduce the risk of spread, we obviously know we can't stop it, we're just reducing that risk. So I really wanted to share my story and help people to understand that while yes, I did follow all the practices, I did get sick, but I still wanted people to know that if you continue to follow the practices, you're reducing your own risk. I wanted to share my story as well because COVID is different for everybody. There's people who just get the tickle in the throat and maybe they have a cough for 3 days and they never lose energy. Then there's people like me who, quite honestly, I regret not going to the emergency room. There was the first week I was really sick, I suffered breathing, and literally getting up and walking 15, 20 feet was an immense amount of energy and almost impossible. And I should have gone to the ER, and I wish that I would have. I think it's been 6 weeks, and I've got a group of our incident command team in here with me in the room, and I'm kind of looking at all of them. And one of them is our infection control nurse who followed my case pretty closely as well, and our director of quality. And both of them, they also, encouraged me to seek medical care, but I was stubborn and didn't do it. And I think it's been 6 weeks, and I finally, just this week, I finally have enough energy to stack my own hay. I had to hire people to bring hay in for me, but I'm a stickler for how it's done, so I had to go fix it myself. But I know everybody in this room would probably be happy to say a few sentences or even speak out about their experiences. We've got 3 RNs in the room. One of them is the OB and acute care manager. And she has been working closely with our team down on our respiratory care wing, taking care of our COVID positive patients and our persons under investigation. And I'm sure she could speak very well about the impact not only on those patients, but their families and our staff that are caring for them. I'm volunteering each of you to actually do this. And they're kind of looking at me and smiling a little bit. Afton, our director of quality, she can speak to it as well. She spends nearly every day, every minute at work on conference calls about remdesivir and all sorts of those other things, staying on communications about that. Rebecca, she's getting all of our results and contacting patients with their results, and then logging the results into the public health website. And it's quite a task. Rebecca constantly works until late at night because most people aren't home to answer their phones during the day. She's our infection control nurse, for those who don't know. So she's working late into the hours to contact everybody. Becky is our clinic manager, and she's got 35, 40 staff down in our clinic that she's helping coach to handle all the people that walk through our doors and constantly assessing the workflows. And I'm sure she could speak to the impacts of it down at our clinic as well.
Megan, can I interject for just a second? I think those are all fantastic examples of folks who could speak to COVID-19 right now in a way that's really compelling. I think Okanogan Public Health has set up a blog on their website. Their social media is really, I think, something to behold. It has become something that's really positive. People are getting questions answered within 24 hours. The only reason I'm pausing there, Megan, because I've had just such a great example of what it would look like for all of our tribe members to sort of brainstorm within their own organization or their own connections who they think they could get to say yes to being a part of this larger video and messaging campaign. Megan, back to you. That's great. Thank you.
Thanks. Sorry, I have a talking problem. I could literally talk for the next hour about this. Our incident command team, we did a little field trip on the very first day of the community testing. We wanted to be the first to jump as a community leader to show our support of public health and the testing being done. So I did a bunch of photographs and shared that. I think I shared it to public health. I'm pretty sure I did. So the very first day, our entire team went up there and we did the walkthrough, and everybody got tested, and proud to say that everybody was negative. I, of course, didn't get tested because I've already been positive, and that would be a waste of time. So our team is definitely in support of community testing, and they continue to promote that amongst our staff and amongst our patients and our communities. But any one of us would be pleased to speak at any time and do recordings to support anything COVID related.
That's great. Thank you so much, Megan. I know there's a couple public health folks who are on this call, so I have no doubt they will follow up with you. Megan just mentioned one more piece that was a request from Okanogan Public Health, and that was to have those who are getting free, taking the opportunity to utilize the free testing, to send a video, send a photo. I just can't understate how important you all are right now, genuinely. And just a real quick, I think, props to Lori Jones and Crystal Escherman over at Public Health, who have just been doing, I think, great work to really elevate their communications in the past couple of months. They're just doing really important work. Thank you. Okay, I encourage you, chat in more ideas, more names. Public Health, I know, has some folks from their team on the line who are tracking those names. And with that, I am actually going to have Michelle come back on and briefly introduce a new organization that's opening in Okanogan County that I think similarly fits into this larger conversation about growing resources. Michelle, you just want to take a couple of minutes and introduce FIRE for these folks.
Yes. So I have Maddie coming on too.
Hi, Maddie. Nice. Okay, I'll get off. Y'all don't want to see me. Okay.
Thank you. All right. So we are here today to share, I hope, some very exciting news. Maddie and I and several other community members had a first board meeting yesterday for a new organization for youth in Okanogan County. That organization is FIRE, the Foundation for Youth Resiliency and Engagement. And I'm gonna give Maddie just a couple of minutes to talk about the mission and important dates that are coming up. And I also want to say that the reason why we wanted to introduce this here and now is because we see this as a great opportunity to connect with you all, to determine the needs right now that we have for youth in this county. So we are really doing this in hopes that we can open up the doors for partnerships and also call out to you for spreading the word about this new youth organization. So Maddie dropped the link, and I'm gonna turn the mic over to Maddie to share more about our mission.
Sweet, thanks Michelle. Hi everyone, my name is Maddie Sandoval and I am a co-founder of FIRE, and we are super excited. Today's our first day that we're going live with all of our information. And so maybe some of you have seen this spunky, bright colored building across from the OMAC library, kitty corner to the bread line, and that's gonna be our location, 23 Ash Street South. And so, yeah, our mission statement is to advocate for equitable opportunities that allow all youth to thrive. And while we're located in OMAC, we do want to make our services available to all youth in Okanogan County. And we know that there are barriers in that. And I think because of COVID right now, we're positioned to bring a lot of our resources online, set up individual support through Zoom calls, etc. And so we will be doing a really soft open starting October 26th, and you'll be hearing more about what that looks like. And then if you go and visit our website, which I just dropped, it'll show you our expanded list of services that we're hoping to bring once we're COVID safe, and then also what our COVID plan is for now. And yeah, so we're just encouraging folks to share our Facebook page and like it, share the website, start to spread the word. I think a big piece of this right now is going to be educational advocacy and supporting youth and families who are working through online schooling. And I think that's it. Is there anything else, Michelle, that I'm missing?
I'm just going to quickly share our website, and so that people can take a look and know that they have reached it once they have visited. So does everybody see that? Excellent. Okay, so this is our website. As Maddie said, soft opening in October, soft opening because of COVID. And we hope to be doing some services beginning in October, but I do want to encourage people to contact us now. I dropped Maddie's email in the chat, and you all can email me as well at Okanogan Chai if you have any ideas regarding partnership. Maddie is going to be taking on the bulk of the work in terms of making sure that we compile all of these ideas, and we will make sure that we have a meeting for interested partners. So if you're interested, if you have ideas, if we can fill a need, please let us know. We've heard several needs here today, including that essentially there needs to be home visits. Teachers, educators, they need help with home visits. They need to put eyes on the kids. I know as somebody who works for the Department of Children, Youth, and Families that we can't do home visits unless we have some kind of concern, specific concern regarding child abuse and neglect. But there's so much in between when we're concerned about youth. There's so many spaces in between that maybe something doesn't rise, but we know these youth and children need to be seen. So we hope that as a community, we can pull together some volunteers, and also that the organization can be doing some outreach work, either via calls or some limited in-home visiting. So again, please email Maddie. Please feel free to email me. If you have any ideas about something that you want us to share about your organization and how it is meeting gaps, like Maddie said, everything that we are doing, our Facebook, our social media, our website is now live. So we would happy to start putting those resources on our pages and sharing those out to the people that we're having contact with. So thank you so much for your time. A little bit of hat switching here. I'm gonna hat switch to my role as Chai co-lead. And I am going to encourage you all not just to contact Medi, but also to contact Alana and I for any ideas, any follow-up ideas that you have. We'll be saving the chat for today, making sure that we log the resources that you all have shared. And we do see a need to provide those in some way to families in a central location. So please email us, let us know if you still see some needs and you have some ideas. Email us in either capacity, either me as my CHI capacity or Maddie if you think that FIRE can be doing something and can make something actionable with potential funding.
Michelle, can I add one quick update? Aiden Spiro, who works for the census, just emailed me to let us know that they are suspending activities on September 30th. And because our response rate is 41.7%, which is still very, very low, he wanted me to plug urgently to the CHI that the external support from his team is going to be coming to a halt at the end of September. So we have lots of work to do in the next 30 days.
Thank you.
Quick update.
Thank you, Alana.
Yeah.
And I do want to finish this meeting off with one very important announcement. We have another, we hope for people to start dropping names into the chat box because we do need reviewers. So if you recall, I've been sending emails out regarding the 2020 CHI NCH funding. And so I'm gonna invite Sahara to come on with me and share some information. Excellent. Yes, there she is. Okay, so Sahara has dropped into the chat the funding announcement. Please take a look at it. We wanted to come on today in these last few minutes to see if we can get people to drop their names into the chat and to fill out the link for the reviewer interest. We do need reviewers. So what is unique to this opportunity is that Okanogan County has an opportunity to review the grants that will serve Okanogan County. We cannot do that without reviewers. So we need reviewers. We need people who know about the needs of Okanogan County to be able for us to be the people who decide where that money is going. So if you could start dropping your names into the chat, we will connect with you. We'll send you the link via email. And then also, Sahara, I believe you dropped the link to sign up to be a reviewer into the chat as well.
Yep.
So either way you want to do it, please, we need the reviewers. We need those fast because the letter of interest is due, I believe, September 9th. Is that right, Sahara?
Yep, we just extended it to September 9th. And it's a pretty short letter of intent. It's all done through SurveyMonkey this year. And I can drop it in again just because I know there's a lot of chat happening. The link to the website for this funding opportunity. And for those who recall, this is the CHI Community Initiatives Funding Opportunity. We have $450,000 available to invest in our 4-county region. What's different this year, and I think really resonates with what Ilana said earlier around kind of the strategy, best strategy being working with like local assets that you have here in the county, is that each coalition has the ability to manage the funding opportunity locally and to really to make recommendations for up to $100,000 of the total funding that's available. So this is really an opportunity for each of our coalitions to really help guide these local projects, as well as really being a part of those investment decisions directly in your county and really, you know, through this process and these projects, like really trying to address our local needs here. So I'm available as a resource. Please do reach out. My email is all over that website, so you can go there. And even if you email the info page at the website, it comes to me. And then you can also find information about reviewing as well. And I am happy to connect with folks offline about that and any questions that folks may have.
And I do want to say, because this was a question for me, that I do want to emphasize that there are conflict of interest opportunities, right? Just because you are applying does not mean that you cannot be a reviewer. So please, 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 please sign up to be a reviewer. We are highly encouraging it. Without you, we cannot decide locally where this money goes. I'm sure that the NCACH would do a terrific job of reviewing the grants, but one of the big wishes that we had, I think, as a CHI was that we would be able to do this locally. And that is a huge thing that Sahara has made happen. Now we just need those reviewers. So please, please sign up.
Nice.
Okay, everybody. We dropped the link in. We hope to see an increase in reviewer signups. I saw a couple of names come into the chat. We will connect with those of you. Kelly, thank you so much. We will connect with you. All right, I think that is the end of the meeting. Again, please continue to email us about resources that you want shared. We will say bye-bye for now. Thank you so much.
Bye, everyone. Thank you.